afternoon. Y'all are coming into the NIRSA virtual roundtable for risk management. My name is Erin Wells, and I'm from the University of Texas at Austin. And I have two co-hosts here with me today. I'm gonna let them introduce themselves.
Hey y'all, my name is Drew Loso. I'm the Assistant Director of Facilities Management and Operations for the University of Notre Dame.
My name is Sarah Shea. I'm at A&M Commerce. I oversee facilities and aquatics. Hi, Kara.
Good afternoon. All right, so just a couple housekeeping things to start off with. We do have the chat on the side, so please feel free if you have questions at any time, comments at any time. We'd love to hear who's in the room, what's going on at your schools, what's going on in your areas, and we're gonna keep monitoring it, and anything we see, we might call you out. So if you write something in here, Stephanie, did you come in with audio? That was one of the prompts. And then if you write comments, questions, concerns over in the chat, we might call you out. So please be ready for it if you put stuff in there. Also, we're gonna hot topic, we're probably gonna be talking a lot about COVID-19 today. So if we could kind of just keep it on how it affects campus recreation, campus life, and maybe not sway into the political aspect of it, that would be much appreciated. So are we ready to get going?
Yeah.
Yeah.
All right. So we made a list of some topics, and again, please feel free to chime in on the chat, and let us know if there's something else we want to talk about. But we wanted to start off with kind of this idea of before COVID, during COVID, and after COVID. So talk to us a little bit about how did your facilities make the decision to close? Did you base it on peer institutions and what they were doing? Just kind of how did y'all did the state make the decision for you? The city? Kind of let us know what happened with y'all.
I'll jump in, Erin. This is Blair from University of Kansas. How are you?
Good. How are you?
Good. For us at KU, we follow the university, student affairs, follow university guidelines. Our facility initially was still open when the university went online. And then once the county decided recreation centers were no longer allowed, then we closed. So we were open a week after the university went online and decided for students to go home. And then once the county and the state did a stay at home specific to rec centers, then we shut down.
Nice. Hey, Greg at Creighton, did your rec sports or your campus recreation make the decision, or did Creighton make the decision for y'all?
Collectively of student life, we just closed all of our facilities before the university made us do it.
Awesome. Hey, Drew, how did you all decide?
So we made the determination as a university to start shutting all of our student life areas down. Rec sports was actually one of the first full units to shut down, just based off of we were getting ready to roll into spring break. So we actually were going to start spring break, I think, on that Friday the 13th. So we went ahead and just made the decision that Thursday the 12th, that evening when we were closing up, was going to be our last any facility operation wise for all of our programs and services.
Nice. So Ben, Boise State, y'all had to close because you didn't have any student employees? Is that kind of what I'm reading?
Yeah, so it happened on the same day, but the city closed all municipal rec centers. So we used that. It was hard to justify us being open when they were closing. And then once we went all online, most of our students are from out of state here. And so we got to the point where we only had a handful of folks left. So our director took that up the division and made the choice to close. We closed prior to a lot of other places within the division.
Did anybody have plans in place for social distancing, or like at the University of Texas, before we decided to close, we went to, we were going to do like every other treadmill you could go on, every other piece of weight equipment. Like we were going to put social distancing practices into place, and a couple other like hygiene related things. Was anybody else going to do something like that prior to then just being like, nope, you're closed?
Erin, this is Jess from University of Illinois, and we had done this, we had had similar conversations about the every other piece of equipment or so, but we had also, initially we were still going to offer group fitness classes, but lower the number of participants. Because at that time we were still given the directive that we needed to be open. So that changed within about 2 or 3 days. But we had initially looked at, lowering our classes that had capacity of like 40 to 10 or 15 to try and be mindful of the distancing piece.
Nice.
So I saw in the chat for a couple folks that you were either going to move some spaces, so basically recreate some fitness centers within different spaces that usually are not used for fitness, or even moving them to basketball courts. Travis, I saw it. I cut you off as well. Go ahead and jump right back in.
No, I was just going to say at Purdue University, Travis Freeland here. So, yeah, we pretty much did the same thing at the beginning. The very first initial thought was, okay, let's shut down all group programming in any aspect and go strictly to only things that you can, you self-regulate yourself was the encouragement at the time. Social distance 6 feet. Based on the CDC recommendations at the time. That went for 3 days, and then from there it was just pretty much we're going remote learning, shut it all down, and we were going right into spring break. So we did very similar to what some of the other universities are doing.
Yeah, Catherine, we did the same thing. We made it so that they were scanning their own IDs as well. Yep, we did that. We had gloves, staff had to glove up. Extra cleaning shifts. I think we bought out the state of Texas on Purell hand sanitizer. So yeah, we had a ton of that stuff.
Curious to know if anybody that's in the room did stay open, and how long you stayed open until things were kind of escalated either within your state or your county, and how that went and how that decision was made.
Yeah, I'll jump in on that one. A&M Commerce, we stayed open until Governor Abbott said we can't stay open anymore. So we started the process of social distancing, like Ashley mentioned in the chat. We did the every other piece of equipment. We moved some of the equipment into the multi-purpose room to kind of space out. We had planned to bring intramural staff in to help keep count of how many people in each space, so we didn't go over our set numbers. We had a meeting that morning, and then Ashley, you can correct me if I'm wrong, I feel like it was like the next day we got the announcement, or later that day, saying, no, you have to shut down. So we didn't really even get that far into our social distancing, but I felt like we were the last man standing when it came to Texas on shutting down. We kind of were, I feel like, a little bit. But we still had people coming in. Our staff still wanted to work, and we were wanting to help them have that income as well. So we kind of saw both sides of either shutting down when others were, or holding out to the last minute for our student staff. But they did take more precautions of gloving up for everything. We added people cleaning machines, and our access is already swipe yourself with the gates opening. So we didn't have to have that worried about, but we stopped checking out equipment and then closed all programming areas as well.
Hi. This is Stephanie from URI. I just wanted to, are we allowed to share what each area did?
Yeah, go for it.
Oh, okay. So we were on spring break when all of this was kind of coming out. So one of our satellite facilities was open, so we were able to go every other treadmill, have the participants swipe themselves in. But by that Friday, our governor had shut everything down and said that we couldn't be open anymore. But the one thing that I wanted to ask, people that are on this, we are able to pay our work study students, but we're still trying to figure out what we are going to do with the students that need to stay in the area, that they have leases or stuff that they can't break, and how do we keep them working while our facility is closed. So right now we're utilizing Connect 2 and having them do some like work from home projects, whether that be updating manuals or just any busy work that we can give them. But I wanted to reach out and see, do you guys have any ideas of how to keep the students that absolutely need pay, how to keep them working?
This is Emmanuel from NC State. I'm not sure if your university has this opportunity, but here at NC State, we were able to pay all our student employees through paid administrative leave. Initially, we did it just through the end of March, but today the decision was made that they will receive paid administrative leave all of April. So we're fortunate to be in this situation.
Yeah, that's amazing.
Yeah, Texas is not, we're not as lucky. Hey, Ross, are you in here at all? Like, do you want to talk about like the LinkedIn stuff? Are you in here? Okay, I'll talk about it. So the University of Texas is allowing LinkedIn Learning. They have different videos and trainings for professional development, like on leadership and communication and like just all these different topics that they can go in and do these trainings on that they can do in place of shifts. We have also allowed that if they attend these virtual roundtables, that they're able to count that. So we're trying to find them opportunities like outside of, but we still are doing the updating the manuals, updating the training checklists, like doing things like that. But we were able to do those LinkedIn learnings, which a lot of them have really enjoyed.
Thank you for sharing, and I'm reading the comments on the side, which is awesome. At first we had this idea like, oh, we'll just get a lot of cleaning done in our facilities and give them cleaning tasks, but then they put our full-time employees, like our full-time custodians, through an extensive training, and then we decided we cannot put students in this type of situation. So that was like, yeah, we're really looking for creative ideas on how to continue to pay them, because the state of Rhode Island right now is unfortunately not able to pay. So we're figuring it all out.
Yeah. Anybody else have anything fun and interesting that they're doing? All right, so Stephanie, you kind of hit on like cleaning. So we wanted to just talk about deep cleaning and like what that's going to look for us when we come out of this. So how are you planning on doing it? Are you going to do it with your internal staff that you have, your student staff? Are you going to use university custodial? Are you going to do outside companies? I know in one of the roundtables I was in, they talked about the Clorox 360. But what are y'all doing?
So I'll start. I think our plans are ever evolving, I think, as everybody's are throughout this process. But one of the things that we're going to do is probably do both internal and external. So typically every year, we have a company come in and do a microbial treatment on all of our soft surfaces, including all of our sports equipment. So most likely we will call them in and probably hit all of our fitness equipment, mats, any of that shared equipment before we open, and then go back and do it again in the summer for all of our sports equipment that's going to be used. But we have internal housekeeping that isn't within our department, but they have a plan for all of the buildings as well. And then we'll hit it from an internal point on all of our quaternary agents as well. So we'll hit that as a pro staff.
Awesome.
Hey, sorry, Stephanie Plummer from California Baptist University. I just put it in the comments, but we about 3 years ago purchased a Santa Sport in partnership with athletics, and it was probably about $13,000, I think, and we split it with them, and that thing has been gold. We've been using it quarterly. We used it right before we shut down. We just turn it on and it sends out whatever magic that disinfects everything. So bump up the use of that on top of our custodial team. But if it's something that you can work into your budget, I think it's definitely worth the ask. And considering what we've been through, I think most people might be able to get it now. Who's going to say no to something that helps get rid of germs? But yeah, we shared it with another department, so that might be an option.
Is anybody else trying to get a 360, Clorox 360, and they are like back ordered till June or July?
Sean Duffy, University of Ottawa. We have one Clorox 360 for our sports facilities. We have a provider that could give us another one if we needed it, but for now we felt we're going to use it as we need to, but we're likely to have our subcontractor do most of the cleaning.
So when I'm looking at the comments, it doesn't seem like a lot of people are going to have their students in doing that towards the end of this. It's most likely going to be like university custodial or bringing in a third party, right?
Yeah.
Yeah, we'll probably do both at A&M Commerce. We have SSE who's currently doing a deep clean because custodial is still working. But knowing our staff needs hours, they have asked when we have that date, can we come in and help get the facility put back together? One of the questions that kind of falls into, and I forgot to add this to our list, Chris reminded me on here, but one of our concerns is PPE. Like we were running out of gloves before we even shut down. So that was a question that I was curious of how, while we guys were open, how were y'all doing your PPE, your gloves? I think, Chris, you asked about a mask. Did the university provide your gloves? Or did you have to order those? And kind of what was your process of that? And if it's kind of hurt you in the long run?
We were pretty lucky at Texas. We had a large inventory of gloves. We did have to dip into our instructional program, like our certification program, to pull from them. But we had a large inventory of gloves, so we're pretty lucky in that sense. So we were just doing gloves. We closed down March 13th. So we didn't even get, I think I had them start gloving up on March 11th and we closed on we never opened on March 13th. So we were lucky, and we're going to be lucky coming back, having supplies.
Curious to know, whenever you make the determination that you are coming back, how's that going to happen? Number one. And then two, from a opening back piece, are you expecting your students to come back and work throughout either the summer period or whenever that is, or are you going to have to make alternative plans and really just have your pro staff operate the building on a limited basis until you are able to hire?
Hey, Drew, this is Blair at KU. We're hearing rumors at KU that we're actually going to be online through the summer. So we're in that waiting game right now of we would want the students to come back just to help, but as long as we stay online, we're probably either going to have to operate ourselves or we'll be closed.
Okay.
So.
Hey, this is Gabby from Virginia Tech. Actually, the governor here yesterday announced a shelter or stay-at-home order through June 10th, which that lingers into our summer semester as well too. So we're kind of on the same boat as that. We're just kind of waiting to play it by ear. But at this time, with it being a stay-at-home order and only essential personnel being allowed out of the house, there's no way to tell.
Thanks, Gabby.
Gabby, what state are you from?
Virginia.
Sorry, what was the question?
You're from Virginia?
Yes, state of Virginia.
Thank you.
Well, we just sent out at Texas, we sent out what we call our intent to return, and we did it in like layers. So if we reopen in May, because right now we're only closed through spring break, I'm sorry, we're only closed through the spring semester. So if we were to reopen in May, would you be able to come back if we were to open for summer 1, summer 2, then fall? So we did it in layers to kind of see who can come back and when.
So you've already sent that information out to students to see what they're coming back with?
Yes, just so that we can have some sort of jumping off numbers, and because we also have to start planning, okay, so we have 8 facilities. So what does that mean in opening facilities? So we've started talking about like slow rolling out facilities. So flagship will go first, and it might be on limited hours, and then we add a facility as we are able to staff it. So that's the plan we're thinking.
That's a really good plan, because we were at URI, we were talking about how we were going to open, and we think we're going to stagger the spaces. I'm the coordinator of aquatics, so needing certifications, like this is our prime time that we do all of our certifications. So I'm thinking with aquatics, I'm just going to open and staff certifications, but I'm also under that regulation of small groups, like what's the number of groups we can certify and how can we get that done? So it's been really complex. We started off doing the same thing as you with reaching out to the students, but then they quickly canceled the rest of the year. So our students aren't coming back, and our university is still making the decision if summer classes are going to be online or if they're going to meet in person. So that's also going to determine what our facilities do, but we're also open to the community. So that's another level there. You know, we don't just serve the students, we serve the surrounding community. So it's all very complex.
Hey, Blair, are you sure it's all certifications? I had heard it was just lifeguarding and C Pro.
Yeah, that's what I understand it as.
Yeah, I talked to our rep yesterday, Jeremy.
Yeah.
He said it was only lifeguard and C Pro for right now, but I asked the question if all the other certifications are going to be an option as well, because most of us do require that staff to be certified to be working the building.
Right.
They haven't gotten there yet.
A side note to those certifications, this is not an automatic extension. They have to apply for that 90-day extension. I'm aware of that.
Right, you have to utilize an IT to submit like for the 90-day extension. So it can't be the lifeguard themselves requesting it. It has to go through instructor trainer.
And I just saw in the chat too, Autumn, that's a great point. Tomorrow's aquatics roundtable, they'll have a Red Cross rep there to answer some of these questions too.
Mm-hmm.
Stephanie, where did you see that they have to go through an IT? I've seen all the stuff where you can just register for the course online.
Oh, so the email that I got from the American Red Cross said that it had to be submitted through an authorized provider under a IT.
So if you have,
maybe it could also be a lifeguard instructor too.
I'm sorry, can you repeat that?
I said maybe it could be like a lifeguard instructor would have that capability, but it has to be someone who has the access to enter course records.
So actually under Red Cross Take a Course, you can have them sign up directly there, and they can complete their online agreement themselves, and they can send you that confirmation. However, if a student is already connected to your LTP, then the lifeguard instructor or instructor trainer can do it for them, but only if they are already connected. But I have invited Rebecca Fisher, who is the aquatic specialist for the state of Ohio, to join our aquatics roundtable tomorrow, and they'll be able to answer all of those questions along with information about the provisional classes tomorrow. And I think that's at 2:00.
Perfect. Thank you.
And does everybody see the link that Andrew put in?
Yeah.
That's that link you were talking about, right, Jillian? Okay. That's what I thought.
So
Awesome.
kind of jumping off this point, since we are on the certification topic, and anybody feel free to jump in here, but in terms of having a database for all of your certifications for your employees, has this changed anybody's plans in terms of how you keep track of those or how you document them? Have you made a plan in terms of when your students or staff do come back to campus, how you're going to recertify them?
Yes, we have. We're allowing them to we're doing blended learning to come back. So they're going to do all of the blended learning before they come back, and then we will do the testing out in person. So that's kind of how we are going to tackle this. We're going to do it lifeguard and lay responder.
Question for you, Erin. If you're coming back and the social distancing rules still apply, how are you going to do the multiple rescue response?
My guess is we will not be coming back if there's social distancing.
Okay, I'm just clarifying.
Yeah, no, yeah, I totally get that question, but my guess is if there's still social distancing going on, we won't be coming back.
Gotcha. We had the conversation that it was a possibility of doing the provisional lay responder for all of our staff, because all of our staff has to have CPRO, and having that for a time being, doing the online, having them come in because we can distance them and give them their own equipment at that point. Just having something on the books that they can use while we have our facility open, if those social distancing rules still apply in there as well.
That's a great idea. Is anybody else starting to think about this and starting to make plans for summer/fall returns?
Yeah, I mean, here at URI, we certify a lot of the beach lifeguard staff too. So we offer 6 classes throughout the April-May season. So we told all of our registrants that you can take the online blended learning class because we got approval from our rep that we could give the online portion, and then when we're able to come back in person, we can hire multiple instructors and do larger size classes pending we have the amount of equipment needed, and then teach it in rotations. So it'll still take the 20, 25 hours it takes to certify, maybe even more with the size of the classes. But I hear that a lot of summer camps are canceling and a lot of summer camps are staying on. So they still need this lifeguard certification. So we're figuring out how to certify a mass amount of people with pulling a lot of the instructors from the area.
Jake Rasmussen, University of Toledo. To kind of add to what Jennifer said, right now we have our certs on when to work in their notes, like when they expire, but we're moving to the Connect 2 system with that to keep better track of the certifications.
And I'm just going to add, hey, it's Jennifer from Stanford. I just add that I signed up for the emails to send me 90-day notifications when any certifications expire. So it sends me the list of the first and last name and what certification is expiring. And so I'm good as of right now for 90 days because I haven't got an email yet. So yeah, that's a fun feature.
We currently use Sub It Up for our staff, and it gives the student and the manager a reminder when they are 30 days from expiring. So that's the program we use.
So I kind of skipped one question that we wanted to talk about when we were talking about the deep cleaning. Are any of you documenting exactly what it is that you're doing to kind of, for lack of a better phrase, CYA, documenting exactly what it is that you're doing so that you have that in place for reopen and stuff like that?
Including the chemicals that you're using.
Yes, thank you.
Yeah.
This is Theresa Fuller from Troy University in Alabama. We actually got a CDC chart that we put on the back of all the bathroom doors and in the showers. we have a custodial staff that Troy University actually hires, and they come in every day and they have to put the time that they clean the facilities. No one's in the facility. We happened to had opened a new facility, $25 million. We had our grand opening in February, and then we had to close in March for spring break. So everything is fairly new in our facility. And we used the students. We did deep cleaning, and they actually logged everything, dates and times, and with the CDC chart.
That's awesome. Is that just on their website? Like, would I be able to pull it and maybe put it in these notes?
Pull what?
That chart that you were talking about?
The chart?
Yeah.
I believe so. Look under the CDC. It actually also talks about how to wash your hands, how to make a good lather, other little tidbits about if you don't feel good in the morning, stay home, drink fluids. But it said CDC, so it might be if you go online. I'm going back tomorrow now. Actually, today Troy University made the decision to do everything remotely. Nobody's going to return to campus. The dorms will be cleaned out by April the 12th. Graduation for May is going to be in the summer in July with the spring and summer courses. We are doing online for summer. So as far as our programs, since we're a new center and we're trying to start our fitness programs and our intramurals, everything is basically on hold for us. So we're hoping that at least once the main flux of the virus goes through and the social distancing maybe goes away, that we're able to go back to the facility.
All right, I'm finding a couple different things. So as I find them, I'm just going to post them.
Cristina, in the comments in the chat, you were talking about you taping off things. Can you touch a little bit more about that, what that procedure is, and then how exactly that is monitored?
Yeah, so Cristina from UT Rio Grande Valley. We have an Excel document listing all of our equipment and locations. And so when we shut down, we went to, I guess, like modified hours just for our personnel to clean. And so we took section by section. We had at least no more than 2 people at a location and still keeping that social distancing. And in regards to the tape, what we did is every area that was cleaned, we taped it. So painter's tape is what we got. So just the blue painter's tape, put little tabs to it. And so that allowed us to know that every nook and cranny was cleaned. Once our fitness floor was taken care of and scrubbed down, then we used the caution tape to make sure that, you know, that area is taken care of and no one should be on it. Any location that we did touch or piece of equipment, we took the tape off, we used it as we needed, and then we knew we had to clean it back up again to then tape it back up. So we did use quite a bit of tape, but it does allow us to be very cautious by means, because we went from no student employees, just our professional staff, to now just our 3 pro staff in rotation with our custodians. And so as pro staff, as we rotate and we're in our building and needing to go to a location or so forth, that tape allows us to know what has been touched. I know for our marketing location, or student workspace specifically, there are several people in and out, so we definitely had to take tape off and continuously clean, just to make sure that everything was taken care of. But that was like our current procedure. I'm trying to find our Excel document to add here, but that was like our way of keeping clean. And then our pro staff that are there are rotating and still doing the cleaning measures in certain locations, or in this case, like facility maintenance.
Hey, Cristina, remind me where you're from?
UTRGD, so UT Rio Grande Valley, very like the tip of South Texas.
So how is this going to change with you being able to have pro staff in the building with Governor Abbott's stay-at-home orders?
Yeah, so just last week, all of our counties went into shelter in place. We're actually till April 30th for us right now, but obviously that would change probably. So our institution is under the essential as well. So we've minimized our staffing to more than 85% being remote from home. So that just allowed for 3 pro staff to be in. And then if we hear further, then it's completely no one in the building. But that's kind of what our institution has advised us to do. And our director is constantly in meetings 3 times a week just on this particular topic.
Awesome. Awesome. Thanks. So one other topic that we wanted to talk about was some of our programs. I know that some of us were out on spring break, so we had outdoor trips out there in the field or wherever, and sport clubs had tournaments and meets and games. And what did that look like when y'all decided to close? Was it a mass, like bring them back, bring them home? What did that look like?
Erin, I'm going to jump in on that one from
Canceled them previously, or had you already canceled them previously?
I'll jump in on that one because that was one of my biggest concerns here at Texas State, with just knowing what was going on, kind of reading the tea leaves about what was happening. It was a constant, worry for me throughout the entire week. And we were having conversations with our director, and obviously he was having conversations with university administration about what was going on. We had actually had a conversation with emergency management the week before, and I'm talking about, I guess, March 5th was when that meeting was, and March 12th was when, the day before we started actually canceling everything, where I made it known to our director, hey, we've got clubs going to Louisiana, Houston, I forgot the third place they were going to that weekend right before spring break. And it was a crazy, chaotic day. And I also had to go to a symposium on campus throughout the entire day. So that was a lot of fun. But trying to contact our clubs, obviously the money that we had spent in terms of having buses for our club going to Louisiana, my concern about having to go to Louisiana in the first place, it was just a crazy, hectic day. We tried to get to our director and to our vice president and the student health center director just notification that we've got students going all across the country. And over the course of the next 6 weeks after that, we were going to go to about 6-7 different places across the country for our national tournament. And there really wasn't a guideline or directive from anyone just, saying anything about what we should do for our student organizations or student travel. So, luckily for me at that symposium, our vice president was there. So, she asked me a few questions. I provided some answers. Our associate director, my director, we were in conversation via email during that symposium that day just to kind of figure out what we would do. And later on that afternoon, I believe it was like 2 o'clock, they had made the decision to cancel all sport club activities through the end of March. Then later it was going through the end of April. And then I think on the 13th, they said nothing beyond, basically beyond the end of the spring semester. So I sent out some information to our clubs. Obviously I had to tell the 3 clubs that were leaving that weekend, hey, you're not going anywhere. We're canceling everything at the moment. We still had sport club practices even that night on the 12th, but beyond that, we've canceled practices obviously from now until the end of spring, essentially till the end of May. It was, like I said, it was nerve-wracking throughout these, throughout the entire time. And during an emergency management meeting, I wanted to make sure that we had on March 5th that our sport clubs and student organizations were taken into consideration, because there was a lot of worry about what was happening on campus, but there wasn't as much discussion on, trying to let people know, hey, we've got students leaving to go out of state to do these competitions, sport club wise, or maybe they're representing their student organization at different places, coming up. And, at that point, we were all trying to figure out what was going to happen. And March 12th kind of happened really quickly with, ending everything. And March 13th was the final decision on just basically shutting everything down for the end until the end of the spring semester.
Nice. Anybody else? So one of the other topics that we had out there was, has anybody started thinking about how they're going to be adjusting their EAPs to to handle a situation like this in the future?
When you say EAP, are you talking just when we have our buildings open, or you're talking about continuity after the fact?
Sure.
Which one?
Sure, either way. Yeah, either way. So like even just SOP, like how do you handle like we got caught we didn't have enough hand sanitizer on ready. We didn't have enough of our cleaner on ready. And by the time we went to like go buy in bulk, it was selling out everywhere. So like those are things we want to think about for the future, and now they do stuff like that does have an expiration date. So thinking about that, but how do we keep ourselves ready? Because when this hit, like Mario said, it hit quick. It like hit hard and fast, and we were prepared, but we weren't prepared at the same time. Does that make sense?
Yeah, that makes sense. Over at UCSB, I also sit on our emergency operations center, so we were having conversations about this beforehand. And it's understood that each department takes care of themselves. And over in California, we have fires, earthquakes, all that fun stuff. So we have a stock of different items. When they started talking about this, we stocked up on hand sanitizer again. We had those freestanding hand sanitizers from our meningitis outbreak that happened a few years back. And we had to set up a vaccination center in our rec center. So those were set up throughout the place. And so we set those back up just to keep a little bit more sanitary areas. As far as the continuity piece, we were readjusting ours at the time and still are, and adding to it to what it looks like when we're partially open, partially closed. But continuity in and of itself, it has to be somewhat vague, because if you try to predict everything, then your manual is a couple pages long. So we were sitting waiting for EH&S directives as far as what to do on next steps, but trying to mitigate those different hazards for our student employees.
Hey, Karen, what types of stuff have you discussed at SU?
Well, we, as morbid as we talked about it, we decided that we probably need to put some type of procedure together when this happens again, from the standpoint of how fast you react to close a facility, what do you close, who do you leave in place, how do you handle students for an employee standpoint, how do you pay them, do you give them work remotely, do you not? So we're in the early stages of talking about it, but we just kind of decided that we probably need to have something in place. And just thinking back on how quickly we had to react like everyone else, maybe just putting our thoughts down and figuring out how we could come up with an outline for that, you know, as far as dividing into like programs, facility, student employees, because it was pretty devastating, as you all know, for our club sport teams to basically be told they couldn't travel anymore, and also they couldn't practice, they couldn't come together at all. So I think it's just putting something together and it being part of your training program for club sports. I mean, hopefully in our lifetime we'll never have to deal with this again, but I think it's something to be prepared for, and just train your students, make them aware. I think all of our students are so immune to these kinds of things, they don't think it's ever going to happen to them. And I think it's our responsibility to teach them that it could happen and what to do.
Yes, agreed.
Hey, Erin, this is Gabby at Virginia Tech. So we already had a standard operating procedure with MIRSA testing. So every spring semester, usually right before spring break, so around February or so, I schedule a MIRSA test with with the Schiffer Health Center. And so they come and they'll swab certain pieces of equipment. We document it and then we get the results back. To date, knocking on wood, we've never had MIRSA found in any of those items. But the way that we're beefing that up is that instead of just looking for MIRSA and staph, is that we're going to be looking for other bacteria, germs, whatever. And so that's how we're beefing up that particular SOP to be a little bit more comprehensive, to not just be looking for MIRSA and staph, but to just be looking for other bacteria that we could identify and clean up. And then on top of that, same thing, we had a protocol for cleaning up for MIRSA, and then I kind of found out that essentially killing these types of viruses and bacteria after all of this happening is that it's the same thing. But so we're beefing that up a little bit, if you will, but I don't think that we're changing anything drastically because our cleaning procedures are pretty robust as it is. So as far as preparing for another pandemic, probably not, but just beefing up some of the things that we already had in place.
Gabby, could you say who you worked with for the MIRSA test again? I missed that.
Yeah, we work with our health center. So I work with 2 of the nurses, and we usually, like I said, we just schedule a time. I normally do about 10 samples per facility. And so we'll swab things like ab mats. And so some of the things we do random. So like an ab mat, we'll never be able to track which ab mat was the one that was found with any bacteria or anything like that. So some of them are random, but some of them are precise. So we always do the push plates in the water fountain. We always do certain doorknobs. We always do the benches in the locker rooms. So we do have some that are kind of specific and strategic every year, but then there are some that will just do a dumbbell, and there's no way to tell, if that dumbbell will remain in that particular weight room because they shift from one weight room to another. So some of them are random, but yeah, so we've been working with them. They send them off to the labs, and then they give us the results, and then I write up a report, and then I just say, sometimes they come back with contaminants that are not identifiable. So I just say, but in the end, I've never written that we've had, again, NIRSA on any of our equipment.
Okay, thank you.
I'd like to ask a quick question about, in regards to our terminology. Excuse me. On our terminology, just from a risk management point of view, the word shelter in place, is that being used in government officials, or the stay at home? Because I hear stay at home, which is not the same as shelter in place. So are people using those interchangeably? Because I think that confuses people if we have that going on. So have you heard it from governors that they say shelter in place, or are they saying stay at home?
I've heard both, not necessarily here in Indiana, but I have heard it used, probably not correctly.
Yeah, I would agree with that. Both as well.
Well, I know in
We've
California,
actually had
they
both because
are.
Birmingham.
Sorry, go ahead, Theresa.
No, Birmingham, UAB up there actually has a shelter in place. The harder hit counties in Alabama actually issued a shelter in place. And then the other counties are just stay at home and have put curfews. The county I'm in, we have a 10 to 6 a.m. curfew, but they're advising people to stay at home because it's up to the governor to actually do a whole shelter in place of the whole state and then get flagged. So each governor for each county is making that decision based on the number of cases that have tested positive.
But Travis, you're asking the question because most people in the risk management world think of shelter in place as active shooter, like you're sheltering in place from an active shooter or an active threat. Whereas the stay at home means sit your butts at home, like don't go outside. And Texas, it looks like the governor is using shelter in place, but in Austin, they're using stay at home.
Hey, back on the, can you all hear me?
Yeah.
So my name's Jake. I'm at Georgia State University. Back on the topic of changing standard operating procedure and EAP. So I guess based on CDC research for epidemics like this, we can expect to see another spike in cases come fall, December, when it starts getting colder again. Has anybody started putting together a plan for, I guess, operating procedures for when we are hopefully open back up, but might have to change some of our operating procedures or our programs based on that?
Hey, Jennifer from Stanford, I really liked what you you put for what you're doing, like even as going as far as taking the emails you're sending right now and saving those. Can you talk a little bit about what you're doing?
Yeah, so this was a project that actually I was supposed to present, or it was the topic that I was supposed to present at NIRSA. So ironically, COVID came out right when I was supposed to present. So ours was talking about wildfires because we had all those wildfires in California, and the smoke, so the air quality index. We had to keep, we had to close the pool, open the pool, close the pool, open the pool. We also have water curtailment shutdowns, so they turn off the heat in our building. So they had to close our inside facilities, but the pool would remain open. So what to do in those situations. So we've compiled all of the emails that we have sent out in the past for those specific situations, and used them as a template. So that way, if it were to happen again, I could just copy and paste it into the email. It also states the guidelines of who do we contact. So I need to reach out to marketing and they need to post it on the website. They have to send it out to this list server. I have to reach out to rec services to let their staff know that they're still going to be working, but the building is closed, but the pool is open, and the communication around that. So who we need to contact and reach out to, and exactly what we need to say to each one. We also have a list of kind of the materials or supplies that we have to keep an eye out for. I'm a crazy person. Some people would probably call them, with the stocking of cleaning supplies, because of certain things that we've had. I'm like afraid that we're going to, I don't hoard, but I do have a nice stock of supplies. So we always have an inventory, and this is the number that we have to keep it at. We do black and blue gloves. Reason being is that way, if we did have a situation where we were using all the cleaning gloves super fast, like what was currently happening, we would still have first aid gloves in case of emergency. And so those are kind of the things that we're doing, and just making sure that we're stocked with the face masks and the gloves for the newest things that we're doing. Does that help? Is there anything else specific that you?
No, that's great. That's awesome. Okay. Jacob, does that help you?
I guess as we get through this, we're kind of taking notes on how we've had to adjust to this. So it's helpful, especially with that document that's going on the community board right now for everybody else's responses. It's definitely helped put together kind of because we're writing this as it's happening.
Yeah. Awesome.
I have a question or comment regarding CPR training, if that's okay. I saw a document out of the UK about how they're training people to put either a towel or something over the face of an unconscious victim if they don't know if that person is infected with the virus, which was something I noticed today. And I do think it's interesting to see what'll come in terms of messaging to the lay public. Yes, we push compressions only CPR, but will instructors need to look at promoting more precautions? And then in the terms of aquatics, if the first step is face mask ventilation, do we anticipate seeing a change there because of the physical distancing and what we've learned from this virus.
Yeah, I'll jump in on that one for a little bit. I definitely wouldn't recommend putting a towel on someone's face, just from an EMS side of it, because I do work on that side of the house. I think part of it's going to depend on how long this goes and when we open back up. If we open back up and we're still doing the social distancing, then yeah, precautions are going to need to be made when giving care. Especially pushing, I would guess, and I don't know because I'm not part of the Red Cross, but I would guess compressions only would be what they would push. But teaching staff to how to have the, I say patient, but the patron hold their own gauze on there and control the bleeding and kind of help them help themselves a little bit. Being on the medical side, I would not be surprised. I know just in the EMS world, we are making changes of how we give care because of all this. So I think it's really going to depend on when you open your building up and how far and how bad this goes. I don't know what the Red Cross is, and if your staff certified through the Red Cross, I wouldn't recommend, we wouldn't make any changes unless it's based on that certification. But I would be very surprised if something doesn't come down from all of this.
So we will obviously want to be mindful of everybody's time. So we have a couple more minutes during this session. But I think the conversation has gone really well, and it's something that we were hopeful of. And we are in talks with NIRSA right now about, is there a possibility for us to do a couple other sessions of this? So are people interested in continuing these types of conversations throughout the coming weeks and being able to meet on different topics? Perfect. Yes, it is. Great. So we'll talk to our folks at NIRSA to see if we can set up additional calls that we can dive a little bit more deeply into this and some of the other topics that we had on our task. But is there any other questions that somebody wants to get to in the next couple minutes that we have?
We also have a list of stuff that we didn't even get to today. So.
We got to the first question though, so that was good.
I just wanted to ask, are people thinking of opening with social distancing protocols still being in place? What are other people thinking? Because I know when facilities started closing or operating on minimal hours, we were kind of looking at what everyone else was doing because we had the luxury of being on spring break during the time. So we were able to look at the schools that weren't on spring break. So I think having more meetings like this will be really helpful for us. So when regulations change state by state, we can kind of determine best practices together.
Yeah, that was actually one of the topics that we had on our list, was because I know, Drew, weren't you asked like, well, what's your governing body saying?
Yeah,
that was one of the questions that was kind of posed, was does NIRSA have a stance in terms of, are they saying here's our recommendation and anything like that?
So yeah, so keeping these, we will make sure that we work with NIRSA to get a couple more on the books and keep this conversation going. We hope to see you all soon.
Thank you.
Yes.
Hey, Erin, hey, real quick, is there any way that we could do it maybe just 1 hour earlier so that those of us who are Easter Standard Time, we can accommodate it within the whatever we're calling
within business hours? Yeah.
Yeah, because I got to go get my dog. So, I mean, I don't know if everybody's on the same boat, but if people have kids or whatever, I'm just wondering if we can all fit it in there. So
yeah, let me talk. I had 2 slots to choose from, and one was like the day after I asked if I could do this, and then it was this. So let me see what's available, and I will work my hardest to keep it in working hours for all time zones.
Thank you.
Thank you.
Thank you all.
Have a great day.